Dr. Cheryl Dine. Cheryl's actually a veterinarian who's boarded specialist in internal medicine, but is also just a computer whiz, and she helps us provide this type of technology to you wherever you are in the world who are joining us this evening, and we really are happy to have you with us. So this evening we're going to talk about this very common feline heart disease called hypertrophic cardiomyopathy, particularly in the Sphynx cat. As some of you may know, we've studied this disease for a while and looked at the inheritance of it in other breeds of cats, Maine Coons and Ragdolls, and I really am incredibly fond of this particular breed myself and have been very saddened to see that the number of them that develop this particular disease, hypertrophic cardiomyopathy. I wouldn't say it's more than other breeds, but I certainly do see it in this particular breed on our cardiology service. And they're such a wonderful, affectionate, very lively breed that we'd love to be able to do something for them to help figure out what causes this disease. So this evening I'm going to give you a little bit of background about hypertrophic cardiomyopathy in cats, what causes it in other breeds of cats, and then we'll talk about what we know about hypertrophic cardiomyopathy in the Sphynx. Now, when Cheryl and I have used this software before and had these webinars, what we found is one of the very best parts of it is folks out there jumping in at any time to ask a question. I've put together about 20-some slides here. We don't need to get through all of them, and so please, if there's anything I say you have any questions about at any time, just go ahead and type them in, and I'll try and stop as soon as possible to answer those questions, because I really think some of the best parts of this type of technology is our ability to have a discussion with all of us, folks wherever you are all over the world. So let's begin then. And I'll advance my slide. What causes and what really is hypertrophic cardiomyopathy? So hypertrophic cardiomyopathy, that's a long term that simply means it's a primary heart muscle disease. That means this disease in the heart muscle is not caused by any other issues that are going on in the body. For instance, high blood pressure can cause heart abnormalities in both people and cats. That would be something that affects the heart due to another problem. This particular disease starts in the heart. It's not caused by anything else going on in the body. And when we look at all the cats in the world, all different cat breeds and different ages, this is the most common form of heart disease that we see in the cat. Now, these are some very nice samples of cat hearts. I know they appear a little gross, but that's actually what a cat heart looks like. These were provided to me by Dr. Matt Miller at Texas A&M, and here is the normal cat heart. Whoops, I forgot. You can't. Let me just put my pointer on there. There we go. Here's the normal cat heart right here. And you can see the size of it. And here is the cat's heart with hypertrophic cardiomyopathy. We can see it's almost twice as big as the normal cat heart. Now, its largeness is really that it has gotten very thick, and that has made the whole heart size very big. What it actually does is the heart muscle thickens. So this is the left side of the heart. This is the right side of the heart. Usually, the left side of the heart should be about 2 to 3 times as thick as this side. And we can see here that this maybe looks 5 or 6 times as thick as this. So this disease is characterized by thickening of the walls going in towards each other, and that makes the amount of space for blood to come much smaller. When that happens, the blood in the cat's body that is supposed to go through the cat's heart and then out to the brain and the kidney and everywhere else doesn't have very much room to go there because it just has a small space. So the blood backs up into the cat's lungs. And on an X-ray, this is what this would look like. This is a normal X-ray here. There's the normal cat's heart. And normal lungs look very black, and that means there's a lot of air in them and they're working very well. This is the cat with hypertrophic cardiomyopathy. The heart size is much bigger than this, mostly because it has gotten very thick. And the blood has backed up because it can't go into that narrow space in the heart, and it has backed up into the lungs. And that's what this kind of very gray area here is. And all of that is blood backing up because the heart is too narrow now to hold that. And so what the cat feels is great difficulty breathing because the lungs are very full of all of that extra blood. And one of our participants was willing to allow me to show a picture of her cat, Gus, who was recently in the hospital because he had all of that fluid backing up in his lungs, and he's affected, unfortunately. And so when all of that fluid backs up into the lungs, we have to treat the cat with a diuretic to back the fluid out of the lungs, and they often need to be hospitalized for them to be put on a supplemental oxygen for them to breathe while the medicine works. And unfortunately, some cats die at this point if we don't get to them quickly enough. Now, I'm very happy to say that Gus went home the other day and appears to be feeling much better, so I appreciate Mary allowing me to use his picture tonight, but this is very representative, unfortunately, of what this disease is. Now, I have a question about, is the fluid that backs up into those x-rays, so let me go back a little second, is that actually blood? And it's not really blood. What happens is the blood is trying to fill that narrow area here in the heart. The blood vessels here actually are supposed to dump into that narrowed area of the heart. And when there's no room, they become just jammed with blood. And so what happens is they are able to push a thin, watery substance into the lungs, what we call pulmonary edema. So the thick, bloody part stays in the vessels, and I apologize if this is getting a bit gruesome for some, but this is almost like a watery substance that is able to sort of squeeze out of these very, very filled blood vessels that are backed up because they have nowhere to empty into that very thickened heart. There's another question, and these are wonderful questions, and again, we have plenty of time, so feel free to ask the questions. I think that's one of the best things about this technology. And this next question is, when a cat is diagnosed with hypertrophic cardiomyopathy at an early age, 1.5 years, what is the typical lifespan that you've seen? You know, that's a very difficult thing to say, and it's actually one of the confusing things about this disease. We used to think hypertrophic cardiomyopathy was one disease, and it was the same in all cats. But now we know that this disease varies differently from breed to breed of cats and probably from individual cats. So for instance, let me give an example of 2 breeds of cats that we know quite a bit about. Maine Coons develop this disease. It's inherited in those cats, and they often develop it at around 5 years of age. Some of them will then live quite comfortably with the disease for several years and not die of the disease. That can be quite different from rag dolls. Rag dolls can get the disease. They often get it as young as 2 years of age, and in that case, they often develop this situation we're talking on an x-ray called congestive heart failure, and they usually don't live beyond 2 years of age. It's a very fatal, lethal form of disease in that breed. We don't know about the Sphynx, and even within a breed, there may be quite variation. So what we know about this disease in humans is that there may be things about certain families that allow them to have the disease in a more severe form, or there may be things we don't even understand yet, like diet or exercise, that also affect how quickly it progresses. So what I usually tell people when they ask me a prognosis is we'll have to see how well they respond to the therapy, and then we'll have a little bit better idea. Some cats go into heart failure, respond really well to the medication, and then go on and live for years on medication. So we generally have to see how they're going to do after the first few months. But unfortunately, some cats do progress very quickly and die of the disease. Again, we're very happy that Gus is doing so well, and I think he's likely going to continue to do that. There's another question about if the fluid is directly related to blood backup. And that's right. This blood that is supposed to go normally into the heart enters the heart from these vessels. And when the heart is not working very well or has thickened, and so that area for the blood to enter the heart has become very, very narrow, blood backs up into the blood vessels. Now, because the pressure then becomes so high in the blood vessels, the vessels allow some blood to escape through the walls of the blood vessels, but within the vessel stays bigger proteins, so what the fluid that it pushes out of its walls is usually a very thin, watery fluid. So what is in the lung is a watery substance that comes, it's almost as if, again, I don't want to be too gruesome for folks, especially after dinner, but it's almost like strained blood. Blood in the blood vessels being pushed so tightly because the pressure is so high, it pushes a thinner, watery substance out of the blood vessels through the walls. All right, so let's move forward then. Again, we're very pleased Gus is home and feeling better. That's a wonderful thing. So this is not a picture of a Sphynx, of course, but thankfully I don't have a picture of a Sphynx with this particular condition. But I didn't want to mention that one other thing that can happen to cats that develop this disease is that they can become paralyzed. Most cats that develop this disease develop what we say is congestive heart failure, where all that fluid backs out of the tight blood vessels and into the lungs. But cats can also form a blood clot because of their heart disease. And so what happens sometimes is an owner comes home and finds them, like this unfortunate cat, paralyzed from the back legs down. And so they can't use their back legs at all anymore. And in that case, sometimes we can help them regain use of their back legs, but that's a very poor prognosis. So this is another thing that can happen with this disease that's very, very unfortunate. Next, I do have another question, which is great. If a cat is diagnosed and medications are given, when do I think they should be rechecked and why? It depends a little bit. If the veterinarian has said they are in heart failure, that means that there is actually fluid in the back in their lungs, that they have so much pressure in those vessels that fluid is developing. In those cases, we usually start them on a diuretic, and because the diuretic can sometimes take too much fluid out of their body and make them dehydrated, usually we like to see those cats back at the hospital in about 2 to 4 weeks just to see how they're doing and make sure we're not making them overly dehydrated. If they're doing really well at that point, then we may back down and say, we're just going to see you again in 3 or 6 months. We try to remember that it's stressful for a cat to go to the hospital. So I don't want to do a lot of rechecking I don't want to do a lot of times where I'm requesting the owner come to the hospital unless it's necessary, because stress for a cat with heart disease, just like for a person with heart disease, is not a good thing. So if they're in heart failure, we'll probably see them back in about 2 to 4 weeks and then try to not see them quite as frequently. If they weren't in heart failure, but we've just diagnosed heart disease and started them on medication like atenolol or diltiazem, there again, we might see them again in 2 to 4 weeks to see how they're doing on the medication, make sure it's not dropping their heart rate too much, and then we might see, let's see you back in 6 months or so. Again, I don't want to see them too often, but it does vary it varies a lot from individual cat to individual cat, and every veterinarian probably, interprets that slightly differently. Next question is, if one cat from a single litter is positive, but its siblings are negative based on an ultrasound, what are the odds of the negative sibling scanning positive for hypertrophic cardiomyopathy in the future? That's a really good question. We know that this disease is inherited in Maine Coons and Ragdolls and would appear to be in the Sphynx as well. I'll show you an example of that in a minute here. And we don't know exactly how it's inherited, so we don't have a genetic marker for the Sphynx. What we do know is that in other breeds of cats and in human beings, you can have some members of the family that will get the disease and some members of the family that won't get the disease. So there certainly is a chance that just because a kitten or a cat has litter mates that are affected, it does not mean at all with 100% certainty that that cat will develop disease. Because its siblings were affected, though, it is one that I would screen a little bit more closely. I'm just going to move on to a slide and talk about the diagnosis, and then I'll go back to the questions. Because this is a disease where the heart muscle thickens, the diagnosis is by doing an echocardiogram, or a scan, as many people call it, that measures the thickening of the wall. So usually we do that on what's called an echocardiogram, an M mode. This is an example of what the heart looks like with this ultrasound. This is the inside of the heart. See how big it is, all of this area. This is when it's fully open, and this is when it's pumping. That whole area there holds blood. Now if we look at the cat that has the disease, it just has this area to hold blood. And that's why all of that blood backs up into the lungs and then gets pushed out into the vessels. I'll check my questions here. So the question was, I think the question was, do we have any idea about the percentages of siblings that are affected for this disease? And we actually do not know that at this time. Next question is, should you check sodium content in their food? That's a really interesting question. So there are two ways to look at it. If the cat is not yet in heart failure, it has really mild heart disease, or it's unaffected but its litter mates are affected and you're worried about it, those cats are still they are still dealing with their sodium properly. Individuals only have problems with their sodium once they have gone into heart failure. That's that state where the fluid is backing up into the lungs. So unless your veterinarian has said that they are in heart failure, you should not need to worry too much about sodium. Now, once they are in heart failure, we have historically told owners to switch to a low salt diet, because if they're in failure, having that fluid backing up into their lungs, having a lot of sodium in their diet causes them to retain more fluid, and that means even more fluid and blood for their sick heart to deal with. The problem is that many low-salt diets are not very tasty, and cats don't like them. But it is very important. It's really important for cats with heart failure to eat. And so if you're very strict and you say, I'm going to put my cat, because it has heart disease or heart failure, on a low-salt diet, and it stops eating for a few days, it can really progress very rapidly, because they start to lose weight and then they get weak and their heart failure can really get out of control. So I don't actually have my patients switch to a low-salt diet, because what I find is they often stop eating for a few days because they don't like this new diet. They lose half a pound or a pound, and they suddenly progress in a negative fashion very quickly. So I think your cat, even if they have heart failure, should stay on their normal, well-balanced diet. But if you give them treats, try to avoid salty treats.
I see a couple of hands raised. If you have questions on content, go ahead and just send them to the text chat without raising your hand. If you have technical questions, send them to me. So I'm VetMed1. Right to the right of the send button, it says send to, and then there's a drop-down arrow to the right, and you can choose an individual to send to. So again, any technical questions, send to VetMed. Any content questions, send to this room so that everybody sees the questions. You don't need to raise your hand. Thank you.
Okay, I'm going to go on for a little bit and talk about what causes this disease, and then we'll come back and answer a few more questions. So, what causes it? In some cases, we don't know. And in people, we used to think, or in all species, we used to think of the term cardiomyopathy meant it's a muscle disease that we don't know what causes it. We now know that in many cases it's an inherited disease, meaning it's a genetic cause. So we know that the disease is genetically programmed to develop in Maine Coons and Ragdolls. Now, sometimes people get a little confused between inherited and congenital. This disease is inherited, which means they are genetically programmed to develop it. But this particular disease doesn't usually show up until they are an adult. So in most cats, after at least 8 months of age. In some breeds of cats, like the Maine Coon, it often doesn't develop until 3 or 4 or 5 years of age. Some breeds, like the Ragdoll, can develop at 10 months of age. But it is usually adult onset, although they are genetically programmed to develop it. A little bit like coronary artery disease in people. Our parents might have had it. We have the genes for it, but we don't show it until at a certain age. That's different from the term congenital. Congenital means something is born with it. So with this disease, the cats are not born with it, but they are genetically programmed to develop it. Now we know that it is inherited in the Maine Coon and Ragdoll cat. And so in both of these breeds now, individuals can send in DNA blood samples, either a blood sample or a swab from the cat's mouth, and have the DNA analyzed. And this is what DNA looks like when we analyze it in the laboratory. There's a computer that tells you the different DNA sequence for an individual cat, and it helps you eyeball and read the sequence by giving you color-coded peaks here. So in a Maine Coon, in this region, you should have a GCC, and affected Maine Coons with this disease have a C here rather than a G. That change in DNA causes the cardiac protein to form abnormally and causes them to develop this particular disease. Now, ragdolls, so there's a nice ragdoll cat. Ragdolls get the same disease. They get it at a younger age, and we know that it is a genetic disease in the ragdoll as well. And in fact, there's a genetic mutation in the exact same gene, so exact same cardiac gene, but in a different location. So when I look at the gene, Maine Coons have a DNA mutation or in this area. Ragdolls have a DNA mutation here. Why I make a big deal out of that is this means that this disease is not the same in all cats. This was not a disease that was just inherited down from some cat millions of years ago. And unfortunately, that means that probably, I hate to say this, but probably each cat breed will find that they have a different genetic mutation. So for the Sphynx, there's no point in, if you have an affected Sphynx or you want to be screening your Sphynx for this inherited disease, there's no point in sending in a sample and running the Maine Coon or the Ragdoll test, because affected Sphynx do not have the Maine Coon or the Ragdoll mutation. So, but I'm going to back up a second before I talk about the Sphynx, and then I'll answer some more questions. Once you find a genetic mutation, so the Maine Coon breed and the Ragdoll breed now know the genetic mutation for their cats that causes this disease. It may not be the only mutation, so some breeds may even have more than one. I don't want to be too depressing about how difficult this could be, but they may have more than one, but at least they can screen for the known mutation that causes this disease by sending in a blood sample or doing a little mouth swab on a kitten that puts some DNA on this little brush, and you send it in and have the DNA analyzed. So that's what we would really like to be able to develop for the Sphynx, so that you could test your kittens and help determine whether they carry the genetics for developing this disease. Now, when we say things like that, and ultimately, hopefully, when we find something, that scares a lot of people, because they think what that means is that you're going to find a genetic mutation and their line will have it, and that will mean that their line will be blackballed from the group and no one will be ever able to breed to their cats again. But we tend to be extremely careful about this type of information because what we know about purebred cats like ragdolls and Maine Coon cats and Sphynx, and I'm just saying it now because I want us to keep this information in mind as we go forward about what our goals will be when we find a genetic mutation, is that purebred cats, whether it's a Sphynx or Maine Coon or Norwegian, whatever they are, come from small fixed gene pools. We can't afford to remove all cats that carry a bad gene from that gene pool. So for instance, approximately 25% of all ragdolls that we test have the genetic mutation. If we remove 25% of all ragdolls from the breeding population, you would detrimentally, in a negative fashion, change that breed. Because when you're selecting for removing one bad gene, there are going to be some good genes that go away in those cats as well. So when they find this information, when you have a genetic marker, or you probably realize this even from screening by echocardiography, you have to use these as tools, not black and white things, but tools to help you decide what the best thing is for your breed. So what we usually tell folks when we have a genetic marker is that we're going to base decisions to take an animal out of a breeding program based on, are they showing a severe form of fit? How wonderful is this individual animal? Maybe it has the genetic mutation, but it's the best one anybody's had for 10 years, and so maybe they should just breed it to a negative and gradually reduce the prevalence. So is it a homozygous, meaning there are two copies of it? So what I'm saying is that what I would really like to do is to be able to identify a genetic marker for this disease in the Sphynx. But I want to put out there right now, because that can be a little bit scary, that we're going to use this information to help folks guide their programs if they like. It won't be the type of thing where you'll want to use it as a black and white, anybody that has this mutation is removed from the population of breeding, because you just generally can't afford to do that. So now I'm just going to answer a few questions. Someone has another question about the lifespan of their Sphynx who's already had a stroke. That's one of those blood clots. And he's having difficulty breathing, and their veterinarian says they've probably exhausted their options. That's a very difficult question, and I'd have to see that cat personally, but I'm afraid if you're seeing I would make sure you're seeing a veterinary cardiologist. Sounds like you are. Unfortunately, cats with this disease in many cases will die of this disease, and I'm very sorry, but there may not be much else to offer that kitty. I'm sorry. Did this happen to most of the cats you are showing us? Yes. The cats that I have shown you this evening, many of them, not all of them, may have this disease. I've asked the owner's permission if we could show of them. I do have a few normals in there who were willing to allow me to show those cats as well. Question is, why does it seem that the males are more affected than the females? I don't know if that's true, and if that is true, that's very useful information to us. And if somebody has information on that, has data, has families, that would be helpful, because mutations or diseases that tend to track more commonly on males tend to be genes that are found on the X chromosome. And I haven't seen, from our families, I didn't know that was true, but if you have evidence you've seen more males than females, please tell me, because that would be an important thing for our research to know about it. And I'll show you an example of that. My next point is what causes hypertrophic cardiomyopathy in the Sphynx. And that was, oh, I apologize, didn't mean to go so fast. That was a picture of Duke, who also has the disease but is doing very well and was willing to be a model this evening for us. But this is a family tree of Sphynx with this disease. So to show you that it's an inherited disease. How this is circles are female cats, so in case you haven't seen a pedigree written like this before. Square is male cat. Question mark means we don't know what happened to that cat. Black means it's affected. So here was an affected mother that had an affected son. This cat was probably connected, or was probably affected. Okay, there's some, okay, sorry. I have a little computer technical thing there. It's all gone. All right, sorry. Okay, so this cat was probably affected because it was a sibling, a littermate of this cat, and it had an affected daughter, and it also had an affected granddaughter. So this family demonstrates that this disease is inherited in the Sphynx as well. Again, if you believe that it's affected more in males, that would be very helpful information for me to have. This one family shows more females, but overall I'd be interested in knowing that. Okay, so here's a question about making the diagnosis. One cardiologist has said that there are only 2 pathologists that she says that she trusts to accurately diagnose this disease. Is it that difficult in your opinion? You know, it is a little bit difficult. I think that the disease is not so hard to diagnose by cardiac ultrasound if you are seeing a cardiologist. So I showed you an echocardiogram picture and I said that's how we diagnose it, but ultrasounding or doing an echo on a cat heart actually is pretty difficult. And Sphynx can be small cats, particularly some of the petite females, and so getting an accurate measurement on them can be a little tricky. So I strongly encourage you to please, if you want to know, especially if you're doing pre-breeding screening, so you're looking for fairly mild changes, to see a trained veterinary cardiologist. There are other people out there who will buy an ultrasound and say they can do the scanning for you at a less expensive price, but you may not be getting what you think you're going to get from them, because accurately diagnosing them, especially early on in a small cat like a Sphynx, can be difficult. So you want to see somebody who's trained. Now, if the cat has died, it's died suddenly, or it died from some other disease, and now we're trying to find out, did this cat die of hypertrophic cardiomyopathy? I agree, particularly if the cat died suddenly, that it can be very difficult to diagnose for sure. Veterinary pathologists in this world don't spend a lot of time learning about reading heart disease. And it is, even though the images I showed you were clearly very abnormal, some cats will die with more subtle heart disease. And so if the cat was asymptomatic and suddenly died, it can be a little bit hard for a pathologist to know with certainty if it did die of that disease. And there just are not a lot of pathologists around. So diagnosing a cat with ultrasound early on by a trained person is not as hard, but as pathology, I agree with that. Sorry, I had to adjust my headset. Is the purple the blood? I had a question about, is the purple the blood? Okay.
Down quite a ways here.
Sorry, bear with us 1 second.
Way down. Down.
Are all these, have I been through?
The colored ones are private ones. The principal are sending private ones to you.
I see.
Just remind them, send it to the room so everybody can see, and that way it'll be black, and then you know to answer that.
Okay, so if you'll send, sorry, sometimes I have a little technical issue. Be sure to send your questions to the room, and that way everybody can see them. Okay, that's a great question. I don't know, can I do a poll?
Yeah. Yeah.
How do they do it? Would they raise their hand?
Yeah, so you just ask the question and tell them to click the check.
Okay, I think that was a great question. Somebody suggested that I do a quick poll regarding whether we think this disease is more common in males in the Sphynx. So please do a green check if you think it is more common in males. And I'll just sit tight for a second. How do I know when they're all done?
I mean, just
okay.
This second, but if you want to see the whole thing, just pull this window out, just grab it by the title bar. Just grab it by the title bar and pull it out here, and then drag it down, and you can see them all at once. Drag the corner down, the edge down here.
I see.
And you can see more.
Sorry, guys. Okay. Well, it looks like, that's very helpful. I mean, not everybody thinks that, but certainly there are quite a few people that have felt that. If you have any, that's very, very helpful for me, because we've looked at actually quite a few genes trying to determine the cause of this, and have pretty much come up with negative so far. But I have not looked at genes on the X chromosome, because based on this family and a few other small ones, I hadn't seen that. So I might ask, if you have any information, you have a pedigree or you have a story about male cats that you've seen over generations affecting it, if you'd send me a quick email tomorrow or this week, that would be very helpful, because it may be that I should be moving in a different direction. So that's a very useful thing. That's great. So it looks like at least almost half the people think that that's true. Okay, so we're almost done with the slides, which is great. So plenty of time for questions here. So unfortunately, the affected Sphynx do not have either the Maine Coon or the Ragdoll mutation. So that's why I need to keep working, and that was one of the reasons I wanted to have this discussion tonight, is to get some information from you, like, we think we see it more in males, and also to try to do a little bit more push for a few more blood samples, because our general approach to this in cats is that we look at the genes that cause the disease in people, because this is a very common heart disease in people. Actually has a prevalence of 1 in 500 human beings have this disease, and it's inherited in them. And so what we have done in the past is looked at the human genes that are known to cause this disease and looked at it in affected and unaffected Maine Coon cats, and that was how we discovered the Maine Coon mutation. Same thing with the Ragdoll mutation. Unfortunately, we know that the Sphynx don't have either the Maine Coon or the Ragdoll mutation, and we've now been through probably the top 10 most common genes that cause the disease in humans, and we have not found any mutations. So it's been a tough one, because we've actually spent a fair amount of time in it, and I feel very dedicated to this project. I think they're a wonderful breed, and I hate to see them so sick, and I would really, really like to find an answer. Again, not so we remove all cats that carry the gene from the population, but that we have a tool, so over a few generations we can reduce the prevalence of the mutation. But we've not been able to find anything doing this approach of looking at genes that cause the disease in people. So we're going to try to switch to a new way to analyze this that we've been able to use in dogs for some time. And that's a fancy thing called a genome-wide analysis. And this is where you use it's actually a computer chip that evaluates huge amount of the animal's genetic information all at once, and it compares affected animals and unaffected animals. But we haven't had a computer chip available for cats, because they have to make them specifically for each breed. And there's a company that says it should have one around the first of the year. And so, and actually the Meurs Animal Foundation, who funds a lot of these studies, has offered that if people like ourselves here at Washington State, if we have a project that is all set to go, we have enough samples ready and we're all set to use this new computer chip the minute it's ready, they will help pay for some of the cost of it to help us start using it in the cat, because they've really wanted to help make cat research move a little bit faster. So there's really a push that if we can get all our samples ready by the first of the year, it'll be that much less expensive to do it, because Meurs Animal Foundation may help pay for it. We really have to have 48 samples, blood samples, from affected cats and unaffected cats. Now ideally they aren't cats that are too closely related, and still can easily, if you have two siblings, a brother and sister or brother and brother, that are both affected, I will happily take both of those samples. But for this first part of the assay, I have to have cats that are not so closely related. I can still use those eventually, but for this first part, I need to have 48 samples of cats that are not related within a 3-generation period, if possible. And that's been a little tricky. I need to have a blood sample because if we use a little mouth swab like I showed for that the kitten we were testing, that gives me a little bit of DNA, and that's fine for running a DNA test, but it's not enough DNA for research. So not enough DNA to do all the tests we're going to need to do to find this mutation. So what we really need is to have these 48 samples from affected and unaffected cats, and then the understanding that it will take us some time, although with our experience with the dogs, once we've used the computer chip, we've usually found something within 1 to 2 years at the longest. And it will take us some money to do it. And so I may have to put in a few more grants to do that, but we've been able to do that. But importantly, we have to keep our eyes on the goal that eventually, long term, what we're going to do is reduce the prevalence of this disease, hypertrophic cardiomyopathy, in the Sphynx breed. Not immediately. We won't be coming out and saying none of these cats in this line can be used for breeding. Instead, we'll say, here is a tool, and we can use it to say this cat is positive and this cat is negative, and we're going to use this information and make breeding recommendations so we can get healthy kittens like this one. So again, this is what we need, and I'll go back to answering some of the questions, and I'll leave this up here and then we'll round up. So we still need 48 affected samples and 48 unaffected. Now, we've made great progress. I think we have about 30 affected and about 20 unaffected, but some of those are cats a little closely related, so we can always use more. So if you have an affected cat, or if you have an unaffected cat that is at least 8 years of age, because what we want to do is be pretty sure that they're not just a late developer of this disease. They need to be at least 8 years of age to be unaffected. We would really, really like a blood sample from those cats so we can use them for our study. And there's some information about how you can draw it. Now I'll go back to a few questions. So one question was, if the veterinary cardiologist we've used for scans is not able to provide the echo on a CD or DVD, can a second opinion be garnered if an owner videotapes and provides that to another cardiologist for consultation? It's really hard, unfortunately, to look. So I think the question is, if you want a second opinion on your cat and they don't have a CD or a DVD, can somebody send you a videotape of a cat and say, is this affected or not? It's actually really hard to get an accurate assessment from a videotape of a cat you're not examining yourself, because you have to be able to measure the walls at certain times. The person who did the echo might not do it the exact same way you do, and so I think a second opinion is a great idea, but if you really want a true second opinion, I hate to say this, but you probably need to take the cat to another cardiologist and let them do the full exam again. Because I know if somebody sends me a videotape of an echo, it is really hard to interpret accurately. It's just they might have done different views. I might want something a little different and I can't see it. It's very hard. Next question, isn't the measurement and viewing of the video the most important issue with diagnosis? There are people who certainly can do the ultrasounds and send them to cardiologists to interpret. Is the magic in the interpretation and measurement? You know, what it is that by convention, the normal values for whether a heart is too thick or not is that the walls should be less than 6 millimeters at a certain point. So you're dealing anyway with a tiny number, 6 millimeters. Now, and that is supposed to be, by convention, at a very specific part in the ventricle, in the heart, right below the valves. The problem is that, you know, a cat heart based on that other picture I showed you is maybe only an inch or two big. They're very small. And so that exact location where you take the measurements is a very small area. And so having your regular veterinarian or even a radiologist take this video and send it into your cardiologist, I know it sounds ridiculous, but they may or may not have gotten the exact area where you are supposed to be measuring it. And when you're dealing with a millimeter measurement, you really want to be accurate. So, for instance, 5 millimeters is normal. 6 millimeters is not. So you are dealing with a cardiologist who's going to measure the difference in 1 millimeter, and it's at one very specific area in the cat's heart, with the cat's heart beating 220 beats per minute. Somebody who just does cardiology, and they do it all the time, and they've been well trained, is really good at lining up that exact area in a rapidly beating, squirming, meowing cat to get the actual measurement. If your radiologist takes the measurement a little bit lower in the heart is fatter at a lower area. And so they could accidentally measure it and say it is too big when they're just at the wrong spot. If they send that videotape to a cardiologist, the cardiologist may only see that fat area and say, well, yeah, it's too thick, rather than being able to see that, well, that area is actually a little lower than they should have taken it. So you really have to be doing the measurements with the cat in front of you so you can do the exact measurement if you want to be accurate. It's more expensive, it's a hassle to go find a cardiologist, but that's really the best way to do it. Next question. The other day a pet owner told me that her veterinarian told her about a blood test that tests the enzymes to indicate whether a cat is predisposed to HCM. This is a really tricky thing. This is a new blood test called brain natriuretic peptide, or BNP. Actually, I'll write that for you. BNP is a peptide that is released from the heart cells sometimes when they are irritated. So this company came up with this blood test that veterinarians can run and measure, and if it is elevated, it may mean that the cat's heart cells are irritated. That's all it means. It doesn't mean a cat has this disease. It could mean a cat has some other disease, or even a virus in its heart, or just is not feeling very well that day. And a cat can have bad heart disease and for whatever reason not be releasing BNP. So as a cardiologist, I don't think that BNP is the best screening test for this particular disease at this point. Okay, next question. If I polled the current positive cats in my own database, what would the percentage of males versus females be? I don't actually know the answer to that. That's a really good question. I know that when I put the pedigrees together, and I just showed you a small part, that there was not a statistical difference between males and females. But since females have 2 X chromosomes and males have 1 X chromosome, of course, things that are carried on the X chromosome, females can still show the disease if they are unlucky enough to get it from both of their parents. And so it could be that all the females that I have just were unlucky enough to get it from both their father and their mother. But roughly, I mean, when I looked at the pedigrees of them, I did not see a pattern. It's one of the first things I look at, and I saw a fairly equal distribution of male and females. Doesn't mean for sure that it's not on the X chromosome, but and I haven't gone back lately to look at all of the 30 that have been sent in. What is the gender? Next question is, why do some cardiologists in Europe use 5.5 millimeters as the threshold, and in the U.S. we use 6? What do I think is a better definition of disease? I think 6. So less than 5 is definitely normal. above 6 is definitely abnormal. I think all cardiologists agree with that. Between 5 and 6 is sort of a gray zone. And so depending on the cat, maybe depending on the breed, perhaps 5.5 is a little bit thick for a cat. But sometimes there's individual variation, just like some people are tall, some cats are short, some are long. Maybe, you know, again, we're talking 0.5 millimeters, which is a tiny, tiny, tiny amount. And so we tend to have built into our system a gray zone of equivocal. We don't really know what that means. For purposes of trying to identify a genetic marker, I want to be sure that the cats that I'm calling affected really are affected, because I want to be sure that they help make, I want to be sure I'm using cats that are really going to help me find a genetic mutation. Something will stand out. I don't want to be using equivocal cats that could turn out actually to be normal later on and just a little bit different. So we tend to use 6 because above 6 really is abnormal. 5.5 to me is sort of an equivocal range. We don't know if that's really affected or just individual variation. And again, it's 0.05 millimeters, so it's a small area. But that's the difference. Question was the prevalence of human beings, was it really 1 in 500 people? Yes. Prevalence of 1 in 500 human beings. Not all of them have horrible disease. So just like in cats, some people will live pretty comfortably with this disease. Some will die of this disease. Let's see. Next question. What errors am I seeing to me in the data sent to you from breeders, from cardiologists, as it relates to the data and finding the genetic mutation? I don't think we're actually finding a lot of errors at all. I think the problem is it's not really anything wrong with the data as much as we don't have enough samples. Sometimes people will send us something that says this cat was diagnosed with hypertrophic cardiomyopathy, but then when I look at the measurements are 4.8 or 5.2, and so maybe that veterinarian saw something that made them think that it was hypertrophy, but the values are not consistent. And it actually takes, as we've talked about, quite a bit of time and money to find a genetic mutation. So I think to optimize our chances of success for the genetic study to try to find the mutation, I really only should at this point use samples that really look like this cat for sure had this disease. And so I'm only using cats where I have an echocardiographic report, ideally from a cardiologist, that shows the measurements that is demonstrating it's affected. Now if it comes from a boarded veterinary cardiologist in this country and it says on it hypertrophic cardiomyopathy and they haven't given me the measurements, I'll usually use that. If it came from a non-veterinary cardiologist, a radiologist, or internal medicine person, then I'd really like to, I want to have the measurements so I know exactly how they measured it. But I don't think they're errors as much as we just don't quite have, 48 is kind of a big number to get, and we just are not quite there yet. And again, ideally I want every sample we can get, but for this first part, I have to only use 1 from each family. So I really have to have kind of 48 affected families from the samples on. Here's a question. I sent a sample of my 8-year-old unaffected Sphynx last year. Do you need another sample for her to use on the chip? Nope. If you sent us samples last year or probably even the year before that are unaffected or affected, and you sent it in a blood sample, those usually give us plenty of DNA. And although we've used some of the sample already in looking at genes, I bet we have plenty still for the SNP, because for the chip, it just takes a very small amount. How should we submit the blood and how much? Oh, that's a great question. That's right here. What we need is a small EDTA tube, and that's what a veterinarian calls as a purple top. And it doesn't have to be more than 1 to 2 milliliters, and it doesn't need to be refrigerated. They don't need to send it with a cool pack or anything like that. Just label the tube, put the cat's name and your last name and send the samples. And there's our address. And ideally, I don't think I put on here, but if you'll put something on the sheet of paper that also says that the cat is affected or it's unaffected, it's an older Sphynx and it's unaffected, and ideally how that was proven. Was there an echo done? If it's unaffected and 8 years old, you don't have to have an echo, but has anybody ever heard a heart murmur? If you go to our website, we have a form up there that you can print out if you like and send with the blood sample, although you don't have to. So you can just send the blood sample. Doesn't have to be refrigerated, purple top. Just is the cat affected or not? Some information, perhaps, if we can give you a call. And it needs to be whole blood in a purple top tube. Do I think there'll ever be a cure for this disease? I don't know that there'll be a cure for the disease because, you know, in human beings with this disease, what they do is, in many cases, do transplantation. And that can be done in animals, but the problem is we, of course, don't have donors because people, they're usually donors to donate a heart transplant because somebody rode their motorcycle without a helmet or something. But, you know, in cats, we don't have that. So, yeah, honestly, one of the reasons I went into genetics years ago was because I didn't think we could. It was so likely that we'd find a cure for this, but I thought maybe what we could do is find a way to prevent it and gradually get rid of it. And ultimately, I think that's what we can do with the genetic tests is we won't remove it right away because we'll not want to hurt the breed, but over a few generations, if we find a genetic marker over 5 or 10 years, we might get rid of it. And as far as a cure, the good news is not all cats will progress and die from it. Many of them can plateau off and not progress and do very, very well on medication for years. We don't know why some cats progress faster than the others, but many cats can kind of plateau off with it. Okay. Next question was, is an experienced cardiologist better than a newer one? I don't really think so. I mean, you know, most new cardiologists have to go through a 3-year training program and then pass a pretty tough 2-day examination. So, and their training program is has to include certain amount of training in each thing to be certified. So, I think for this disease, a young or an old cardiologist, you want somebody who cares and likes cats and will do a good job. So ideally, I think you do want a cardiologist. So I got a question regarding, someone sent me a DNA sample of an affected cat when she was 14 years old. And I recently, so I'll start over. Patty sent me a DNA sample of an affected cat last year, and she passed away today, which I'm very, very sorry to hear about. And would it be helpful for us to get a tissue sample of her? You know, probably not. I think that's a really good point, and actually, if you have an affected cat that you think you may need to put to sleep because it's suffering, we really would like to get a few small tissue samples. We can send you a very special solution for your veterinarian to take them in and send them to us immediately after he dies, so we can have the tissue for our analysis, and that would actually be very helpful. I'm very, very sorry to hear about Miska. I think at this point, because she's already died and it's probably been a few hours, that's okay. I mean, we probably wouldn't be able to use very much of it, but we really appreciate you asking, and again, I'm really sorry to hear about it. I'm glad it sounds like she felt quite well for a long time. Next question is, they have a HCM positive Sphynx. Where could I send the blood sample? It's an excellent point. We would love a blood sample from that cat, and I've put the address right here up on the slide. That's our address, and I believe it was in the notes. If you received notes from Cheryl today, the last page would include this information, which is the shipping address, and this information about I'm going to get rid of that. we need from your veterinarian, the small blood sample, and that it doesn't need to be refrigerated, but the address is right there. Let's see. In my opinion, does a raw diet contribute or negate the overall health of a cat diagnosed with HCM? I don't know. I mean, I think there's risk. The risk to a raw diet is that even though, yes, I have a cat who I love dearly, and she loves to catch mice. She does. I don't let her go outside, but I live in an old house, and there are mice, and she catches them occasionally and eats them, and I find the head lying downstairs. But cats do eat raw meat, absolutely, but they eat it right away, and so there's no time for bacterial growth or anything. My concern sometimes with the raw diets is that sometimes they're processed in a way that they're just not safe, because it's not the same as a cat that just killed that chipmunk or the mouse and ate it right away. And so my concern with raw diets sometimes is if there's bacteria in them and a cat got a bad E. coli infection, it could get quite sick. But from a cardiac view, there's no data, or that I have no reason to believe that a raw diet is detrimental or negative or positive for a cat with heart disease. It is negative for a cat with heart disease to stop eating and lose weight. You don't want that to happen. So you never want a cat that has bad heart disease or heart failure to stop eating if you can. So I don't want to switch diets if they should just stay on whatever they want. We have no strong feelings about raw diets. Okay, here's a cat that was diagnosed at 2 years of age, and they've been told that diagnosing HCM has led to a longer life. Is that true? I don't know. We honestly don't know if diagnosing them early and maybe starting them on medication would slow down progression of disease, but I think it's reasonable to me that might make a difference. And so I think early diagnosis and possibly starting on drugs like atenolol and enalapril may help increase the lifespan of that cat. Let's see. Is there a significant association with enlarged papillary muscles and HCM? That's a really good question. I mean, they're definitely, large papillary muscles can be an example, or sort of can be one of the characteristics of hypertrophic cardiomyopathy. So having big papillary muscles can be a sign of this disease. That said, we sometimes see Sphynx that have kind of misshapen papillary muscles, and I don't think veterinary cardiologists know for sure if all of those, if that is always hypertrophic cardiomyopathy or if that could be a Sphynx variation. It's a really interesting question, and we just don't know. Okay, is there I think I answered that question. Am I only wanting values above 6 millimeter for the 48 affected cats? You know, if they are less than 6 millimeters, but you have if the veterinary cardiologist believes they have hypertrophic cardiomyopathy by other things that they have seen, then I could use those samples. But it'd be really helpful to have a copy of the report that says, you know, something by the cardiologist why they caused it. And when I'm going to write something on here, when the person measures it, the things that usually tell me would be abbreviations like IVSD or LVPWD. Those are wall thicknesses during diastole that should be greater than 6 to be this disease. If they didn't write one of those, but they still said HCM and you're able to get us a blood sample, I'd still love to take it. I mean, I'll look at the report and see how we can use it. Is there a document with all my inclusion criteria so I can look for cases over here where I am? Well, the inclusion criteria would be somebody just saying, I mean, a cat that is diagnosed with hypertrophic cardiomyopathy that ideally has walls greater than 6 millimeters and doesn't have other things that could cause it like hyperthyroidism or high blood pressure, but I'd be happy to send that out to you, Elise. Okay, prevention. Is hypertrophic cardiomyopathy ever simply spontaneous and not inherited? Probably yes. You know, there may be cases that it's caused by possibly even a virus or something. We don't know. We know that it is inherited, at least in some families of Sphynx, and it's certainly inherited in other breeds of cats. But this is a confusing disease, and it doesn't always all fit into one little box, so it certainly can be. Does using multiple breeds for outcrossing hurt our chances of finding a gene marker? Hard to say, but hopefully at least using, I don't know the answer to that. So we will hope that that since most of the Sphynx we've looked at don't seem to have any of the mutations of Maine Coon or Ragdolls, we're going to hope that most of their disease is fairly similar. And I think we're just going to have to look and see. Can I touch on the difference between HCM and systolic cardiomyopathy, since we see both in Sphynx? Systolic cardiomyopathy is what's also called dilated cardiomyopathy, meaning the heart is big and the heart muscle gets weak, whereas hypertrophic disease, the heart muscle gets thick. So with systolic disease, the heart muscle doesn't pump very well, and with this disease, it doesn't fill very well because there's no room. We don't know exactly why some Sphynx get systolic cardiomyopathy. I mean, there are a lot of unknowns here. There are some cardiologists that believe that if a cat has very, very bad hypertrophic cardiomyopathy, that in some cases the heart cells will start to die because they're not getting very well oxygenated, and the wall will get very thin and it will become systolic cardiomyopathy. So I can write that on here. Systolic cardiomyopathy, the word was, which is also the same as dilated. And so I don't know, but there is a theory that systolic cardiomyopathy may be end stage, sort of bad hypertrophic cardiomyopathy in a cat that didn't go into heart failure but lived long enough and developed this type instead. Okay. Have I found heart failure more common than throwing a blood clot in HCM positive cats? You know, my sense is that I see more heart failure in Sphynx than I do see throwing a blood clot. Now, we already had a comment from one person today that said she had a Sphynx that was throwing blood clots. I'm very sorry about that. That sounded very sad. But I think overall I tend to see, and I hear from you folks, people that email me about their cases, more heart failure than blood clots. Okay. What measures can we take in addition to medications to help their cardiovascular system stay as strong as possible? And are there medications to stay clear of or any supplementations to avoid? Boy, it's an unknown. I mean, I think that if there's really no known prevention for any of this at this point. That's why we just don't know a lot about this disease and this breed. And that is why it is so important that we really focus on your breed. Now, that's not different from other breeds. I mean, there are a lot of breeds who contact us, like Norwegian forest cats, Bengals, British Shorthairs, that have this disease in their breed. And it is in each case different from the other breed, and in each case very little is known about it. So you guys are not different, and actually there's more known now about Sphynx than there is about Norwegians and British and these other things, but we're still at the tip of the iceberg in all of these things. Each cat breed is different, and each cat breed probably needs significant study all on its own. So we know nothing about prevention other than if we can find a genetic marker, we can at least try to remove the prevalence. What I would say is if you know anything about the family, if anybody ever told you the parents were affected or the grandparents were affected or a littermate was affected, that is a cat that I probably would take and see a cardiologist once a year and say, you know, I'm concerned because this cat may have some risk factors that make him more likely to get it because he's got it in his family. let's echo him once a year, and that way if the cardiologist sees anything, maybe starting on medications very early on will make a difference. We don't know, but that's what I would do. Question is, am I correct in understanding that if my Sphynx is 8+ years old and does not have a heart murmur, there's no need to screen for HCM? Is this a safe point? I don't know if this is a safe, I don't know. The question is, if a cat is 8 years of age and has not developed it, is it not going to develop it? I cannot say that with 100% certainty. There are exceptions, but from our research, it would seem that the disease in this breed tends to be much younger onset, so 3 years of age. And so what we did is we sort of made our best guess of playing the odds, because it's hard to get 48 unrelated cats to go in and get an echo done by a cardiologist, because somebody has to pay for that, and that's a lot of money for folks. So we made their best guess and said most likely cats that are at least 8 years of age and don't have any evidence of heart disease are unlikely to be affected with hypertrophic cardiomyopathy, and we will take those. It would be ideal if we could get 10-year-old Sphynx. The older they are, the more likely they are not going to develop this disease. But in order to get the cats for the study, we sort of had to find a point where it was likely we could still get the samples, and so that was how we set that age. As far as raw diets that are high in cholesterol, could this be bad for them? No. Interestingly, cats and dogs have very different coronary artery system than humans, so cholesterol is not a problem for cats and dogs. They don't have to worry about getting coronary artery disease or heart attacks. The biggest concern I would have would be bacteria, that if it's uncooked, if it's raw meat and it comes from a butcher or somebody who doesn't keep it the cleanest, if it's less expensive and it's not kept the cleanest, that there could be bacteria in them. And as you might remember from hearing about humans that have gotten E. coli infections from undercooked meat, that can be fatal. So the one thing about using the raw diet is that bacteria can be fatal. And the difference between your cat going out and catching a mouse and eating it right away is that that bacteria in that mouse hasn't had a chance to ferment and really develop. If you take raw meat from the slaughterhouse that's been sitting there for a day or two and they weren't so sterile with it, that could have loads of bacteria in it. And E. coli can kill you. And that's why we know the stories about Jack in the Box, people eating a little raw hamburger, or I won't mention any specific restaurants, but where people have died from that. So just be careful with that. Can a rise in aortic to left atrial ratio be an indication of HCM if all other measurements are fine? That's a good question. Evidence that the left atrium is getting a little bit big is often a hallmark of HCM, but sometimes it just looks a little bit big and it's just a measurement thing. So if everything else looked okay, I probably wouldn't worry too much about it, but I might have your cardiologist re-measure that in 6 months or a year just to be sure. Is it possible that is it at all possible that there is something different about the Sphynx that is different, like a thickened septum? I guess if the question is so that some of these are just normal, I don't think so, because we know enough. I get a lot of calls about Sphynx that are in the hospital because they've gone into heart failure. So I don't think it's just that Sphynx have a thicker than normal heart. I do think there is something special about Sphynx, and I think they have a very different form of heart disease, and I think they're a wonderful breed, and they really, we need to focus at it and look at it that it is different than everybody else. But I don't think it's just that they are slightly more thicker just as a breed variation, because we definitely see cats that are really sick from it. Is the cat's activity level and diet a good indicator that HCM has not progressed? Cats are pretty stoic, and so certainly a cat that is lying around a lot, if you know it has heart disease, might suggest that it's not feeling very well and slowing down, and if it's really active, it's doing well. But cats, until they have really bad heart disease, if they're young, try to still play a lot. So I don't know that you can say that for sure. Have I read Dr. Michael Hord's report to the diagnostic community on the connection between ketamine and the drug causing HCM gene to essentially begin to progress? What is my opinion on ketamine in surgery? I've not seen that. I don't. Ketamine in a normal cat is just fine, and it's used all the time in veterinary medicine. It's very safe. The problem with ketamine is that it does increase the heart rate, and it does increase the ability of the heart's muscle to contract. So in a cat that has disease, if you have a cat that has hypertrophic cardiomyopathy, you wouldn't want to use ketamine as the drug for that surgical procedure, because you can really make the heart pump a lot harder and could put it into failure. There was a little question. Let's see if I can get to the next one. What age should you start having your cat screened? He's 6 months of age. You know, I would say at 3 years of age, I would have him start having him screened with an echocardiogram. If your veterinarian, your general practitioner, ever thinks they hear a heart murmur or a cardiac arrhythmia before 3 years of age, I would have it screened at that time. And particularly if he had any family history. If he has no family history and nobody ever heard anything, then I think 3 years of age is a good way to start. Okay, would a cat at 10 years of age that becomes equivocal or positive, would this be considered as simply old age or still a possible problem with the pedigree? I think I would say, I cannot say with certainty, but so the question was, if there's a cat 10 years of age and now he seems equivocal, could that be early HCM or could that be something else? It could be hypertrophic cardiomyopathy in a Sphynx, but I think highly unlikely. More likely, it could be some other things that occur with a cat that gets a little older. Sometimes they develop a little high blood pressure, and that can make it thick. Sometimes they develop a hormonal problem called hyperthyroidism that can make it be a little thick. And sometimes those things are just starting, and we can't document them very well, but they're making a little bit thick. So I would think that that was unlikely, you know, it's possible, but I think it's more likely that in a 10-year-old that it was something else. What are my thoughts on close line breeding with the Sphynx breed? I think that line breeding, or basically inbreeding, is detrimental, because the problem is that we don't know exactly how this disease is inherited, but most likely it's a dominant trait. If you breed cats that are closely related, you are increasing the chance that you will produce cats that will have 2 bad copies of the gene. In the ragdoll community, in their cats that have 2 copies of the gene have the most lethal form of it. And so if we are inbreeding or line breeding, the chances that we develop cats that have 2 copies of the bad mutations are much higher, and then you are much more likely to get really sick cats. That's actually true in Maine Coons as well. The cats that have 2 copies of it or are homozygous are much more likely to have the severe form of the disease, die of sudden death or heart failure. So your chances of having cats that have, if you do have a problem in your line, your chance of having more mildly affected cats that live pretty comfortably with this disease are higher if you are outbreeding. So if you think you have any problem with this disease in your line, even if we don't yet have a genetic mutation for it, I would try to outbreed. Is the chip a SNP, or what kind of it is? It is a feline SNP array, and it comes from the Illumina company, and they produce the canine one as well, which we've had great success with in our lab. They believe the feline SNP array probably will be available the first of the year. These things are a little hard to get going. Okay, does hyperthyroidism mimic hypertrophic cardiomyopathy in cats? Yes. So hyperthyroidism can look just like hypertrophic cardiomyopathy on an echo or at death. If they die and somebody opens up their heart, the walls look thick. So in an older cat, if they develop a heart murmur or they develop an arrhythmia and somebody does an ultrasound and the heart looks thick, we should always check a thyroid because it could just be that. Going outcrossing or outbreeding, is that a good thing? Diversity matters. I think outcrossing, particularly until we know what the genetic mutation, is a safer way to go, particularly if you know you've had any problems. There's a question about what about line breeding and generally healthy lines of Sphynx that live to be 18 or 22 years. Do I think that's detrimental as well? Personally, I think that line breeding is always risky because although you are increasing the amount of some good traits, you are also increasing the amount of a bad trait. And in most cases, we don't see recessive traits until 2 copies of them show up. So you might not have as much HCM, but you might be, by line breeding, increasing the amount of blindness or hip problems or endocrine problems or something else we just don't know about. So I think in general, it is healthier to breed out. So I think we have gotten through all of the questions so far, and I'll just round out here that we know this is an inherited disease, at least in some Sphynx, and it is not the same as the Maine Coon or Ragdoll. I feel really devoted actually to this breed. I think you have a fabulous breed. I don't own one yet, but it will be my next cat, and so I feel really determined to try to work on this problem for this breed. I think they're really wonderful, and I think we have done a lot, but we haven't found anything. So I really think our next step would be to aggressively work on the SNP array as soon as it becomes available. I have a student who's going to continue to work on looking at the genes one by one, and we'll keep doing that. But if we have the samples, even if we don't have money from Meurs Animal Foundation, as soon as the SNP array comes, we will run it in the Sphynx if we have enough samples. So, and we have quite a few, but we really need to get to the 48-48. So we're probably halfway there with each group. So if you're able to, if you have an older cat or that could donate a sample, even if you have 2 older cats and they're siblings, please send them, and then we'll keep them straight that these are 2 from the same family. For the first part of the test, we'll just use 1, but we can still use those. Same thing with affected cats. Now I also know sometimes it's very stressful for an affected cat to go to the hospital and do a blood draw. I don't want to stress anybody's cat over this. So if you have an affected cat, you just think it's too much for him to go to the hospital, that's okay. I understand that, and we'll be fine without your sample. I don't want you to feel obligated to take him in and stress him and have him get all sick just to get our blood sample. But if they are affected and they're feeling well enough to give us a blood sample, that would really help us out a lot. There's just a few more questions that I'll do before we quit tonight. Here was a cat that was scanned as having HCM mild positive, and a PCR was tested for viruses and anemia, and it rescanned a year later and is now HCM negative. You know, is this common? I don't think it's common, but there is some suggestion in human beings that there may be some viruses that can sort of cause the heart muscle to become inflamed and thicken temporarily and then go away. We helped out with a study maybe a decade ago now where we looked at heart muscle of cats that had died of hypertrophic cardiomyopathy as well as some other forms of cardiomyopathy. And we did find panleukopenia in about 1/3 of the cats with HCM. Those were not of a cat of a specific breed. Those were cats of all breeds. And we don't know. That doesn't mean panleukopenia caused their heart muscle disease. It was just found in the heart muscle after they died. And so there is some thought that viruses may play a role, but cause and effect we don't know. And so if your cat is diagnosed with this disease and is showing other signs of systemic illness at that time, it's certainly always worth rescanning them because it's always possible. Should a cat be tested earlier than 3 years of age if they are intended for breeding? I think that's a good idea. I mean, this is an adult onset disease that can show up any time, really. I mean, once they're an adult. Some will show it at 2 years of age. Some will develop it at 6 years of age. Some will develop it at 5 years of age. You don't know exactly when your cat will develop it. So because of that, if you use it for breeding and it shows the disease at 5 years of age and you've scanned every year until then, that's nobody's fault. That's just the way it happens. You've done your best to screen every year and now it develops the disease. But I do agree that in an optimal world, if you can afford it and you're using it for breeding, maybe it would be helpful to have it done at 2 and at 3 and at 4. The odds of finding it at 2 are not high, but if you're going to use it for breeding, at least if you did find any abnormalities at that time, it would be helpful. Has there been a campaign in other breeds that was particularly successful for getting people to send in samples? You know, I have to say, I think you guys are doing phenomenally. I'm harping about how we need 48 samples, but you're doing great. I mean, I've really been incredibly impressed with the number of samples. You're doing great. We just are not quite there yet. I think the Ragdoll people were also a wonderful example. They were a small group. They had, they were kind of a community. They talked a lot amongst themselves, and they sent in samples, and we were able to get it done. They were lucky because theirs was in one of the genes that causes the human disease. So they didn't have to go this computer chip array. So they didn't have to have 48 and 48. But we've done most of the common genes, so we're kind of stuck with this next approach. But honestly, I think the Sphynx community is doing phenomenally. We have other breed associations that are nowhere near what you've done. So really, you're doing extremely well. We've been extremely impressed, and honestly, that's why Cheryl and I were really happy. Cheryl's donating her time here to be here tonight and set this up so we could do this for free, just because you have been so great in doing this whole grassroots thing to get us the samples. So I think you're doing great. We're just saying that we're not quite there, and so and we can run the chip if we need to without the 48 samples, but the odds of us getting an accurate answer are better if we have roughly 48 in each group. And the odds of us getting some money for the Meurs Animal Foundation to do it are better if we have 40 in each group. We don't have to, but the likelihood it's going to be accurate, all those things are better if we can get enough samples. But I think your organization is really almost every day these days we're getting something, or we're getting an email saying we're working on getting samples. So I'll keep you posted, but we just wanted to meet tonight to kind of give one more shove, especially because there is this sort of early January deadline to get going. And I think we've gone through just about all the questions we've gotten today. So again, we really are very dedicated to your breed. I think it's a phenomenal breed, and this is a tragic disease, and we'd like to do whatever we can to reduce it and help you have very healthy, long-lived Sphynx. And I appreciate all the Sphynx who've donated their pictures and their blood samples and their time for us to study them so far. Both Cheryl and I thank all of you for joining us from all over the world, wherever you are, and she's going to go ahead and try to save this and put it up on the web. So if you have friends, if you thought this was useful tonight, and I'm not sure if you did or not, but if you did and you have friends who'd like to hear it, she'll make it available so they can access it in a few days on the web. And my email is there at the bottom, so if you have comments or have questions you want to ask me privately about your own cats, or you want to send us some sample, please don't hesitate to email us, and I think I'll sign off there. Happy holidays, and we hope to talk to you early in January about running the SNP array.
I'll also say goodnight. I'll be sending you an email tomorrow with a link to the recording. Originally, the recording will be in this same format. It'll take me probably a week to 10 days to get it up in a web-based format, and then it'll be on the Cardiac Genetics website. So you'll be getting details by email. So again, thank you for your participation, and good night.
Where is that?
I'll get to a view. and set it back to layout and the default. I'll pack everything back. So turn your mic off.
Where is, I'm sorry. Oh, there.
Yeah, just when